community that is an alive and well learning community in conjunction with the Cultural Competency Collective. And this is our first learning community since the onset of the pandemic.
Yes.
2021. So, hey, Teresa,
exciting. How are you? Hi, Cecilia. You look beautiful as always.
Ooh, but thank you. I don't know how this morning, but thank you. I'm feeling a little allergy, but it's kind. You're kind. Thank you. We're going to give everyone a few more minutes to roll in, you all. So excited to see familiar faces and familiar names and some new ones as well. We have a wonderful learning community for everyone this morning. So we'll give people about 2 more minutes to roll in, and then we'll introduce ourselves. I will introduce new folks and I'll introduce our panelists. Why don't we roll through the chat and start utilizing the chat as a communications tool? Put your name, put where you're currently situated. Just because we are mostly Kansas Cityans doesn't mean that we won't get some other folks from around the state or that we're not somewhere at a conference. So put that in, and then put in a 1-word feeling word about how you're feeling about our new learning community this morning. So as you can see, I'm excited. Teresa's excited. So put whatever word in you would like. And remember, there's no good or bad word. They're just words. I saw a person that came in, I think her name was Annie from Drum Farm. Annie, Drum Farm is near and dear to my heart. John Trammell is an ally to me in this work of centering equity and anti-racism. So, hey, Annie from Drum Farm.
Hello.
Meg Boyko, hi, how are you?
Good. I will tell John that you mentioned him. He'll be excited.
Please do. I just saw someone from the St. Louis area, Meg Boyko. Lester is in the Boot Heel. Many of us are based in the Kansas City area. Jermaine is all the way in Vegas this morning. I'm in Detroit this morning. And so, this is getting ready to be a thing. It's getting ready to be a thing. Just Missouri, but all over. So I'd like to introduce myself, you all. My name is Cecilia Belter Patton, and I'm the Director of Leadership Development and School Activation for Alive and Well Communities. It is my great pleasure to be here. I hold this space with a lot of love as a person who is deeply connected with Alive and Well Communities, and also was deeply connected with the Cultural Competency Collective of Kansas City and our offerings that we have done for the last 10 years. And so this is a joint effort of love and tenderness and care that we're moving forward. And I know that everyone is really glad for us to be back and moving. Hey, Susan, I see you on there. I saw Teresa as well. I'll be seeing other people. I just, was scrolling through. So I want to introduce everyone this morning and give everyone an opportunity to share whom they are. Most importantly, I'd like to introduce Jermaine Alberti. Jermaine is the interim director of Alive and Well for our Kansas City operations. And so Jermaine, if you would come off mute and introduce yourself and give some welcomes, that would be great.
So good morning, everybody. Yes, I am in Las Vegas, but I am a native and lover of Kansas City, Missouri. And that's why when I was asked to assist with sustaining our work in Kansas City and expanding it, I happily agreed to do so. And so I'm so excited for this first learning experience. And we're going to talk about a very important topic that's dear to my heart. When my son was 17, he had his first attempt of suicide, several attempts thereafter, but he is fortunately with us today. and on his journey of recovery and healing. And so it was my son's principal, vice principals, counselors, teachers, therapists, faith community, and myself and his mom that got him through that dark time of his life. And so I know that when you have strong schools working with students who are dealing with mental health challenges, they can make it. But it takes us all as a community to come together and do that. So that's why I was so happy to have our guests join us today to talk about their efforts in addressing mental illness and trauma in schools. And then as a community, we can make a difference. So we'll talk more about some statistics and so forth, but I'm just happy to be here and see all your wonderful faces on the screen. So I'm gonna give it back to Cecilia and you can pass it to our panelists.
Thank you so much, Jermaine. I'd also like to lift up our other Kansas City Alive and Well team member, Micah Chrisman. Micah is on with us. Micah is our communications person for Alive and Well. And so we are the Kansas City team. And so we're very happy to be here with you all this morning and recognizing that this is statewide. Alive and Well is a statewide effort that centers trauma-informed care in health services, in education, in not-for-profits, in for-profits. Many of you all may know or may not know that Alive and Well educational leaders help to develop the Missouri model for trauma-informed schools. We also have the Missouri model for trauma-informed care in our health spaces. And so we are very deeply entrenched in trying to provide as trauma-informed and trauma-aware Missouri as we can in all the areas in which we are servant leaders and helping everyone to be aware of this and then to move through the trauma-informed lens. And so, as Jermaine said, our topic today is mental health, wellness, and wholeness of Missouri's youth. Through a trauma lens. And so we have an esteemed panel that is going to be working with us the first half of our time together today. Our panel will be with us until about 9:55. And then we're going to break into community space with one another from about 10 to 10:30 and give you all time to be in breakout rooms and discuss what you might like to see moving forward in our learning communities, what we can learn with and about and for together. That is always our aim with Alive and Well communities, to make sure that we center the voices of our leaders and volunteer leaders and what they would like to learn about and share their knowledge about. And so that's what we will do. So I would like to take this time to really lift up our panel and allow them to share about themselves. We have some esteemed folks on our panel this morning, so we're really thankful that they chose to have some time with us. So first, I would like to introduce Dr. Letitia Woodley of Kansas City Public Schools and give Dr. Woodley time to introduce herself and share about her commitment to trauma-informed schools. Dr. Woodley is partnered with Alive and Well, along with our other panelists, Travana Alexander Tony, to ensuring that Kansas City Public Schools is one of the first fully trauma-informed districts in our state. And so, Dr. Woodley, if you would share out about yourself and your commitment to trauma-informed schools, we'd greatly appreciate it. We can't hear you. Maybe try again, Dr. Woodley. Okay, so maybe come out and then come back in, Dr. Woodley, and then we'll see if that's going to help. And while Dr. Woodley is exiting, Travana, will you introduce yourself and your role in Kansas City Public Schools as well?
Sure. Good morning, everyone. Thank you, Cecilia, for having me this morning. I'm delighted to serve on this panel. My name is Travana Alexander Tony. I am a licensed clinical social worker, and I serve as the behavioral health manager for Kansas City Public Schools. I oversee the work our licensed social workers and licensed professional counselors do to move forward our trauma-sensitive initiative. While I am a New Orleanian, born and bred, I have been in Kansas City for about 15 years. And I am deeply rooted in this community. I've served in the child welfare arena in both the public and private sectors. I have private practice therapy, and I have students, children who are students within our Kansas City Public School District, which just strengthens my commitment to moving this work forward. We know that mentally well children perform better academically and in life. So we are committed to moving this work forward, and we are happy to discuss the steps that we are taking this morning.
Thank you, Travana. Thank you so much. It has been a joy, you all, to be working with Travana and the other trauma clinicians in KCPS and the great work that they are embarking upon. And so we look forward to doing more. Dr. Woodley, are you back with us?
Hello, can you guys hear me now?
Yes.
Okay, success. Well, listen, so I had no fear that, I have a dynamic behavioral health manager, Miss Alexander, who doesn't need me on this call. She can, really speak to the work that we're doing here. So I was like, okay, Travana, just take it away. So I am Dr. Woodley. I am the Assistant Superintendent for Student Support Services for Kansas City Public Schools. And it's a pleasure to do this work. I am originally from Alabama. I did about 25 years of work in Georgia in different spaces in education. And my daughter graduated from college. I said I can go anywhere in the country and try to make a difference in the lives of kids. And I heard about the work that needed to be done in Kansas City Public Schools. And so I'm a transplant. I came to Kansas City 4 years ago, and it has been an awesome, awesome journey here in Kansas City. So I'm so excited about the work that we're doing here in Kansas City. One of the first things that I was approached with when I got here and beginning to do this work is that Kansas City has had no less than 100 murders since 1966. And meeting with our students, they talked about having to go home and see bloodstained sidewalks. They talked about having to see yellow tape in their neighborhood. They talked about the plight in their neighborhood and the gentrification that's going on and the stress and so what we saw is that our students was faced with so many adverse childhood experiences and how that was affecting their developing bodies and brains in our school district. And so we knew we had to do something different. And so we went on a campaign to really increase our social and emotional supports in many different areas. We'll dig into this later, but we just really tripled the number of clinicians in our school district, made sure we had school counselors in every building full-time because we were sharing school counselors. We actually even moved our security office, security department, our SROs into the Office of Student Support Services to make sure that they were not re-traumatizing students in their efforts to keep our schools safe. So we have done a lot of work in this area. We did a major undertaking where we totally transformed our code of conduct. So we're on a wonderful journey in doing this work, and I'm excited to be a part of this conversation this morning. In hopes that we can share what our lessons learned, the good, the bad, and the ugly, what we've tried and was not so successful in, and the things that we're doing that we find that are successful. So I look forward to the conversation.
Thank you, Dr. Woodley. And thank you, Travana. Again, I'm very excited about the work that is happening in Kansas City and that's embarking in Kansas City. We have a stronger foothold with Alive and Well in the St. Louis area, and are glad now that this is starting to open up throughout the state. So I'd also like to give this time to introduce Alive and Well family that are here with us as well on the panel. Mr. Lester Gillespie. Lester is based in the Boot Hill. I believe Lester is in Charleston. Is that correct, Lester?
Yes.
Lester is the project director for work that we're doing, that Alive and Well is doing in the whole Blue Hill area, so Southeast Missouri, that are centering trauma-informed care through our community lens, through the school lens. And so Lester, if you can introduce yourself and share from your expertise of who you are, and then we'll introduce Ramona, and then we'll get this puppy started this morning.
Okay, great. My name is Lester Gillespie. I am the CEO for Stella Consulting, which is an engagement. I'm pretty much a specialist as it relates to community engagement. And so one of the things that has been missing in the Boot Hill is the fact that we were never able to come together until this moment and working with Alive and Well. And so a lot of our problems in our area are so similar in each county. So we're attacking this by county. So we are looking at about 6 counties that we're targeting. And so within those counties, we're working with the community from a community-based standpoint. So we're doing the workshop series, all 3 workshops, in all the counties in the Boot Hill. And so we just had a mass shooting in our community. It was 16 shot and 2 killed. And it really just blew us away because our population is like 5,000 people. And so for something like this to happen in a small community such as Charleston, you know, it's eye-awakening, but it is also a need to show how important it is for us to be doing this trauma work. I look at in the Boot Hill, we have a great deal of mental health crises going on. And so we're trying to address these issues in such a way in which we want to be inclusive. And also we want to definitely make sure that we have clinicians involved so that we can work through this process. So as I was listening to Ms. Woodard, I mean, it's kind of like the same situation, even in a rural that's kind of going on in the city. It might not be as intense, but it is there. And so one of the things that we're trying to do is to be inclusive with the education piece, having the schools get involved in this trauma work, as well as continuing our efforts within the community. And we kind of just received some seed money to do a program called SOC, Saving Our Community from Gun Violence. And Alive and Well will help us with the focus groups and also being part of the evaluation so that we can build from that. And hopefully we'll be able to put together a steering committee that will allow us to address gun violence and let that steering committee to be the individuals who drive their work and work with these local schools and local communities, because it's happening all over in the Boot Hill. I mean, it's happening all over the country.
Absolutely.
But the other part of it is happening too much. So that's me in a nutshell. And I'm just excited about being part of this panel and learning and listening. Thank you.
Thank you so much, Lester. We appreciate you being here. And we'll dive more deeply into the efforts in the Boot Hill throughout the course of the panel. Last but certainly not least, I would like to introduce and welcome one of my partners in trauma in our efforts with Alive and Well, Ms. Ramona Coleman. Ramona is the manager of youth advocacy and activation for Alive and Well. And so she works with youth all over our state, and we'll be working with youth here in Kansas City and KCPS as we do some lunch and learns and really opening up that lens for our youth. So Ramona, will you introduce yourself, please?
Good morning, everyone. My name is Ramona Coleman. I am here in the St. Louis area representing Alive and Well. I have a background in both education and youth development. I have experience leading youth development programs and mission-driven programs that really focus on social emotional learning and really uplifting our young people and uplifting their voice. Right now, my work at Alive and Well has really had the opportunity to support our young people, kind of mainly in the St. Louis area. We have some young people in the Boot Hill area as well, as they are advocating to change what their communities look like. And right now the focus really is on what their schools look like, and really making sure that we are advocating for more mental health education, support, and services within our schools. And so that's really what the focus of my work currently is right now with Alive and Well. So I am happy to be with you all this morning and excited to be a part of this panel.
Thank you, Ramona. We're going to share about the exciting things that are happening with our Alive and Well Youth Ambassadors and the work that they're doing around their wellness and utilizing their voices. And so Jermaine and I are going to tag team this morning our panel and work together with questions. We also want you to be a part of that questioning process as well. Please put your ahas in the chat, put questions that you might have in the chat. We will have some time for Q&A at the end of our panel before we go into our community focus groups during the second portion. So if you're having some things that are running around in your head and if you like some, maybe not an answer to, but for us to question and consider and some answers as well, please put that in the chat. Remember, the chat is a communication tool for us to be in communication with one another. And so I'd like to get us started with our panel this morning. Again, thank you all for being here. I'd like to open this up first to Dr. Woodley and Trevonna. You know, Dr. Woodley shared with us the different things that we are, as did Lester, about the violence and the different trauma and the experiences that are rocketing through our communities that our students have to face on a daily basis that can and often does interrupt their wellness and their wholeness and their mental health. And so I want to ask you all, why do you believe that a trauma-informed lens is the answer?
I'm looking at Trevonna. I guess I'll get started. One of the things that I like to say is in Kansas City, we were experiencing a pandemic prior to the pandemic, you know, with everything that our students were going through. And that's why we, began to launch this work and understanding that this work is, it's not an overnight thing. You're not going to be able to say, oh, I'm trauma informed. It's going to take years in order for us to get there. But our students were faced and families have been faced with so much. And they have not been able to get the supports that's needed. So I believe that, the reason why we've got to, this has been something that's ongoing. I even go back to my own childhood growing up and just understanding that, we were dealing with mental health issues, back then, and we didn't have the supports necessary. And then the issues with students of color or families of color that really didn't embrace the fact that, that we need to engage in mental health. So we have so many different barriers that are against us with, trying to roll out this work, people's mindsets about mental health and the stigma and, and Black and brown families about getting mental health services. But we have seen, over the last couple of years, a breakdown where people are now being more open to get the services necessary in order for our families to be well. But we're still facing some barriers to getting those services available. And then additionally, the number of individuals that need services and the availability of those services is also a major concern with us being able to deliver this work that we know that's so needed.
Yes, thank you, Dr. Woodley. And I would just like to add to that, why a trauma-informed approach? It's because trauma-informed is basically about helping to create safety, helping to build relationships, and helping individuals feel connected. So we know, considering the population within the Kansas City area, we've just talked about the homicide rate. I also chair the Violence Free KC committee. So we receive the KCBD crime statistic report every month. We see the adverse community environments that our students live within. And so being trauma-informed means creating safe environments in our schools, building strong relationships. We know by the research that students and youth who have at least a strong relationship with at least one adult does better in life and is more optimistic. And so that's what being trauma-informed is about. It's about helping our educators and school administrators understand that when our students present with dysregulation, or, leave the classroom without asking, or does not follow instructions the first time, it may not just be resistance or defiance, which we hear oftentimes. It's often how trauma manifests in the learning environment. And so being trauma informed means educating our educators and administrators on that and helping them to understand how to respond in a way that makes that student feel safe and builds relationships to facilitate positive change. So that's why a trauma-informed approach is the best approach.
Thank you, Travana. I'm glad that you highlighted that, and thank you, Dr. Woodley, because I think oftentimes we believe as adults, we forget that who we were as children, number one, but we also forget that, oftentimes our students are acting from a space of need. Behavior is nothing but an outcry of a need that has not been met, right? Whether it's good behavior or whether it is behavior that we feel more challenged by. And so we will put some type of characterization on the behavior as opposed to recognizing the trauma that is behind that. So thank you for highlighting that for us. And thank you for highlighting that trauma-informed practices centers relationship. It is key. I put in the chat that every student needs at least one champion, right? And we do have statistics. It's something akin to about 80%, that if we have one adult champion in a child's life, they have more ability to self-actualize in the ways in which we want. And so I'm thinking about this from a perspective of youth, Ramona. What are the youth sharing in your engagement with them about what they need in their communities, in their schools, in order for them to be as mentally healthy as they would like to be?
So as I think about some of the conversations that I'm currently having with young people, it really is about those relationships. And really what KCPS currently has in place with adding more clinicians, one of the major things that our young people are speaking to are having more individuals and mental health professionals in our schools, more individuals in our schools that understand what being trauma-informed is, actually making sure that our teachers are receiving professional development that centers around what are some of the mental health resources in our community. Also, schools partnering with those community partners that provide the community supports and provide those clinicians, because we recognize that resources are a challenge. But what overall our young people are asking for are more individuals who are educated, informed, and are caring. They are looking for attentive young individuals above all. So we love that our teachers understand the content. We love that our teachers know what's happening, but the young people are really looking for those individuals who are going to build those relationships with them, that are going to listen without judgment. They are seeking those relationships above all.
Oh, thank you for that, Ramona. That was the key. I think oftentimes we think that our kids want something extraordinary, and really they want the extraordinariness is the ordinariness, right? Us being human, us showing that we care, us showing that we're humans. Because I think oftentimes too, educators, those of us who provide social services, think that we don't come with our fair share of trauma as well. And so making sure that we do the things that we need to do for ourselves as adults so that we do not trigger our students, so that we're regulated as well. And so it is a give and take of how we build relationship with one another and center that relationship in our communities. Thank you for that, Ramona. Jermaine, are you getting ready? I saw your mouth.
Well, yeah, I just threw in the chat feed a quote from an article that was released back in December from some stats from the American Academy of Pediatrics that declared a state of emergency over child and adolescent mental health concerns. And so what we see here is that before the pandemic, this is before the pandemic, 1 in 5 children ages 3 to 17 in the US had some kind of mental, emotional, developmental behavior disorder. And also that the suicide rate, the estimates were about 6,600 suicide deaths among people ages 10 to 24 in 2020 alone. And so pre-pandemic, we were in crisis. So now we're in the midst of coming out of a pandemic, and trauma is this major thing that people tend to ignore until it comes home. And I've called trauma a germ. You just walk into it. And I mean, and you just, I mean, like you're not planning to be traumatized that day, but you walk into it, and next thing you know, there's these ramifications that are coming of that. So I think it's so important that the work that Ramona is doing with regards to listening to our young people and having them create legislation to take to Jeff City to affect change at a legislative level is so important. What we know is that if the adults in the lives of the young people walk alongside them, we can do this together. So it's not an issue with just getting our youth to adjust their behavior, but adults us adjusting our behaviors to address where they are right now. So I'm really, really curious of how we are hearing our youth voice in the KCPS school district. How are they helping you all shape policy, shape decisions that are made on their behalf? Dr. Willie, could you speak to that?
Yeah, so what's the powerful piece? I kind of alluded to that when I began talking about the work that we are doing here in Kansas City in our 5-year strategic plan. And it was centered around student voice. What we did was to as a part of us developing our strategic plan, we brought youth in from all across the district and asked them what they needed, right? And so it was then, I never forget, it was we had tables and we had Mr. students up from different schools. And one of the students, one of the tables, it was 8 students at a table, ages 12 to 18, 19 years old. And they said between the 8 of us, we've lost 48 people, right? And they talked about the grief and loss. They talked about the pain. They talked about the fact that, yes, they know they come to school angry and may not behave well, but they talked about the fact of, carrying all this pain and not knowing what to do with it, not having mental health professionals in their schools to be able to support that work. They talked about even if they did have a relationship with a teacher and they come home, they come to school and they share with an adult about what's going on, their parents are hotlining. So we talked about hotlining poverty, where the parents, they talked about the blight in their neighborhoods and the fact that if the neighborhood is being increased in value or being repaired, then the prices of rent goes up. And so the parents have to decide between paying rent and paying for utilities. And, and then, if they, if the lights are off or the heat is off, they're paying, and they tell someone that, they don't have food, then the parents are basically penalized for going through poverty. So, I mean, we had deep conversations with our students as a part of building out our framework. And that continues. I mean, even, we're not where we want to be with student voice because we want to go deeper. And that was a conversation that Cecilia and Ramona talked about, how deep we want to go through to kind of build out this framework of student voice in more details. But we have restorative justice ambassadors that kind of helped us frame our student code of conduct and talked about how the student code of conduct made them feel like they were going to a prison every day versus coming to a school. And how punitive it was, the punitive language, and it kind of helped us shape how we do discipline within our school district. So we really center our work in student-centered way to make sure not only we're using best practices and research, but also hearing from our students and making sure we're addressing their needs.
Thank you, Dr. Willie. And I think that's the beautiful marriage between Alive and Well and the CCC work, because we have to make sure we have policies, procedures that are culturally sensitive, culturally aware, that resemble and show cultural humility. And so I'm so glad to hear that your policies are reflecting the things that people are dealing with in their individual cultures in the district. We know that we cannot do this work alone. And so it's going to take all of us to come together. And so what I would invite individuals to do is, if you would, like Susan has done, go ahead and put in the chat feed questions that you have for panel members, and we can also use those too. I always feel like when you come to one of these meetings that you need to have some kind of ahas, as Cecilia said, or some kind of takeaway. So we want to make sure that we're not just talking at you, but actually engaging you in the process. One question we have from Susan is, can you speak to the disproportionate representation of students of color Are trauma or mental health symptoms tagged as behavioral disciplinary issues?
I think this is really important. Thank you for that question, Susan. Trevon, and if you can speak to this, anyone that's ever heard me talk about restorative practices or trauma-informed practices knows this story, that it hit me. And the reason why I remember is because this article hit the Kansas City Star the day after my birthday in 2015, where it stated that Missouri was the #1 expeller of pre-K to 3rd grade boys of color, primarily Black boys. And then when I started to do the research, I found that we were in the top 10 in every student demographic of Black and brown students, be there boys or girls, no matter what the age, in all of the United States. And so, Trevon, if you can talk about that disproportionate way in which our students enter into the relationship of discipline in our schools, the way that they oftentimes get tagged with mental health or behavioral issues, when it may be that it is a way in which we respond as opposed to what is going on with the student.
Sure. So thanks, Cecilia. Ms. Jones, thank you so much for presenting that question. It is something that we have delved deeply into as Kansas City Public Schools. As Cecilia referenced, nationally, there's, disproportionately Black and brown students have higher referrals of disciplines and documented discipline referrals and out of school suspensions. Kansas City Public Schools was aware of this, and we dug deep into this. What we did is, this was part of the reason why the Student Rights and Responsibilities was revised and included students in making revising this code of conduct, as it was formerly called. We have ran data equity reports on each of our schools, which really highlight our schools' populations based on demographics, race, gender, if there are special education needs, if there is attendance issues, and really looked at the students who had the highest number of referrals in the system, just a discipline referral, even if there was no action, as well as the out-of-school suspensions and the in-school suspensions. So we can clearly highlight to our school administrators, as we dig into the data, let's look at this. What are the trends are we seeing here? What populations are being disproportionately impacted, and what's causing that? So that's where we get into our trauma work and educating our educators. We are aware that a student of color could do the same act as a student that's not of color, and the response is going to be very, very different. So what we did was we removed the subjectivity from our Student Rights and Responsibilities. We are also, following that change of theory in the Missouri model for trauma-informed schools, where we are building knowledge of our educators so that we can facilitate change in practices and then ultimately change in culture, right? So we are aware, and we're doing this. We recently just received a discipline report, and we're happy to report we are showing positive growth in our students that were disproportionately penalized prior to. Our code of conduct revision to provide interventions instead of punitive measures is showing change. We are not where we want to be, as we've already stated, but we are well on our way, and we will keep moving forward with the hard work. I will also say that we are doing book reads to educate, like Push Out. I know Dr. Woodley we've provided this book to a number of our school educators to read. We have provided other books like, Don't Suspend Me, so that we can know that when we suspend our students and they're out of our schools, then we are just continuing the pattern. They are back in the environments where they've learned the behavior that they're demonstrating. And we want to disrupt the school to prison pipeline. So this is just one way that we are doing that.
I also want to add, this is so, of course, I'm so excited about this work. The one thing that I did want to add was, in Kansas City Public Schools, day 2 of your employment in Kansas City Public Schools, no matter what your position, you could be the superintendent, a custodian, a cafeteria worker, day 2 of being employed with our school district everybody must go through a training on understanding trauma and implicit bias. Those are I mean, from the beginning. So we set the standard that in order for you to be employed with our district, you know what we value, and we will be a culture of caring, and we address these issues day 2 of your employment in Kansas City. So I'm excited about the journey and where we're going. Additionally, our goal is for 100% of any educator that has any interaction with students to do discipline that restores training. And so our goal is for 100% of our teams to be able to be trained. I'm excited that 21 out of our 31 schools have over 50% of their staffs that's been trained in this particular area. So we are, we are following the Missouri model of the change in knowledge, the change in practice, the change in culture, the change in policy, and the change in systems, and understanding that is, you've got to follow that theory of action in order for you to see that systemic change that happens throughout your school, district, or even the organization.
Thank you for that, Dr. Woodley. We did place the Missouri Model for Trauma-Informed Schools link in the chat. Thank you for that, Micah. And we think that's really important, you all, because the Missouri Model for Trauma-Informed Schools does center equity. I know that there was a question, Kirby, how are you? Dr. Kirby, it's good to see you. Put in the chat. Also, are we doing the things that we need to do to educate our white educators, teachers, social service professionals, et cetera, ways in which they can move through a more trauma-informed lens. And that is the center of the Missouri Model for Trauma-Informed Schools. It's the center for the Missouri Model for All Trauma-Informed Care. That equity has to be at the center of that if we are trying to approach work around trauma, around any oppression, right? That if we're trying to do that through a race neutral lens, then we're missing the point. We did not get here by being race neutral. We got here by being race central, right? And so if we're not having those conversations centered around race, centered around ways in which we are disproportionately oftentimes punished, our students are for being students of color, if we're just really going to be honest about that. And if we're not honest about about the case that our students have been in, yes, we've been in a pandemic for the last 2.5 years, and we've been in an endemic of racism for the last 400 years. So what does that look like when we have this aspect of another layer that affects our students? I'd love to bring in Lester's voice around this as well, because, we've been talking about Kansas City and St. Louis, which are the cities, the major cities in Missouri. But we also know that the endemic of racism and the pandemic of the coronavirus, COVID-19 pandemic is not only situated in Kansas City and St. Louis, it's situated all across the state and all across the globe. And so I think Lester did a great job of highlighting while the Charleston and other areas in Southeast Missouri and the Boot Heel are small, oftentimes their issues are the same as urban issues, right? People want adequate housing. People want access and opportunity to employment. They want transportation. They want good education for their students, for their children. And the violence that we see oftentimes happens in rural areas as much, if not more, in rural areas as it does in urban areas. So Lester, can you briefly talk about what you're seeing happening with students in the Boot Heel as well?
Well, of course, you're absolutely correct when you talked about the pandemic, because it really puts us back from an educational standpoint. I mean, we got kids in middle school that had missed 2 years of elementary, and some of them can't read. And so that's some frustration that lies there. The other part of that is that when we talk about the youth having a voice, this is the only platform that I know of that I've ever been involved with as far as trauma-informed care is concerned. This is the only platform that you can speak on many issues, especially when we talk about systemic racism, when we talk about equity, and it also makes everyone in the room, regardless of your nationality or your race, it makes individuals in the room pay attention, because you cannot erase one's events that happen in their life. And so when I say that, I think it's important that we continue to build upon this platform, because it gives us an opportunity to speak from and to be open. And so as far as the youth are concerned, we have to teach them mechanisms as well. You know, you can't be afraid to deal with things that is bothering you. And when it turns into trauma, the only thing that's going to happen, somebody's going to get sick, somebody's going to be unhealthy, and somebody's going to be unproductive. So we have to deal with these with trauma in such a way in where we can't be afraid to talk about the issues. So that's pretty much my take.
I think especially in the Boot Hill, I know many people don't realize, and this was astounding to me as a veteran educator, that corporal punishment is still allowed in the Boot Hill.
Well,
That means that,
let me say
yes.
this, because of Alive and Well, and they did change their policy.
well,
So
good.
I'm excited. I mean, in Charleston School District. So
Charleston, not the whole Boot Hill, right? But in Charleston.
Yeah, but we part of
One step at a time, one step
There
at a
you go.
time.
One step at a
So
time.
if we don't know what I mean when I say corporal punishment, that means that people have the permission to still paddle children, to exert some type of corporal punishment on students who have perceived to have been dysregulated or misbehaved. And when we think about that from an equity lens, I don't think that I have to say to anyone on this call how problematic that is, right? So Ramona, please share about ways in which students from the Boot Hill, from St. Louis, and soon to be Kansas City, I'm so excited about that, so excited about that, are engaging with Alive and Well through the Youth Ambassador Program and the different efforts that you all are doing.
Absolutely. So right now we have an advisory board, as well as we have youth ambassadors. Our youth ambassadors meet monthly, and they have talked, they have gone through our youth empowerment workshops. Those workshops really talk about what trauma is, how it affects our brains, how it affects our body. And now that we have this information, what do we do with it? How can we advocate for change in our community? Our youth advisory board has been working for the past year and a half on how can we create safer schools? How can we ensure that everyone feels safe going to school, and what does that look like? And really coming back to school in person after after COVID-19, or after the pandemic rather, it was really around how can we support our peers in terms of their mental health needs and the mental health supports. So in the next 2 weeks, not even 2 weeks at this point, we have our youth advisory board, as well as our youth ambassadors, are actually going to the state capitol. And while at the state capitol, I think right now we are meeting with about 7 or so representatives and senators, and they are sharing their recommendations on mental health supports, education, and needs for students in the Missouri area. Some of those things that they really want to highlight are young people having the opportunity to take at least 5 mental health days with unexcused, without penalty. And so right now, I saw Jermaine raise his eyebrows, but that is really what's happening across our nation right now. Our neighboring states, such as Illinois, recently just passed it, and I think about 6 or 7 other states literally have just implemented that this school year, where it is important that not only that they get those days so they can come back and they don't have that additional stress of being ruffled or frustrated about missing school, but they're able to get that support. In addition to that, when they come back to school, making sure they have the opportunity to check in with the counselor or social worker or the therapist there at school. One of the other pieces that was really big to them in terms of recommendations that they are highlighting or lifting up when they go to the state capitol is around professional development around mental health education for all those who work within the school. So very similar to some of the work that is happening at KCPS right now. They feel it's important that they're able to go to anybody in the school and they're share that information. In addition, making sure that the curriculum is inclusive, so it also represents them, and that is in terms of safety. Knowing that I am being represented in what I'm learning is important to the young people in terms of their safety and in terms of their mental health. So they are excited. I just have given a few recommendations, but they are excited to go and share and meet with. Right now, I think about 4 or 5 individuals who actually are on the education committee at the Capitol. But just there are also other representatives who also are sponsoring some bills around mental health. So we have a strategy going forward, and we are excited to share our recommendations, and hopefully that will be the beginning of some change that is much needed in our state.
So excited about the advocacy component of our youth ambassadors being able to go to Jeff City, and recognizing as a person who exists in that arena that it starts early, right? If we can get people recognizing that our voice matters and that we are the ones who elect our elected officials, and so therefore they should work for what we want and not what they want. How wonderful that our youth get to be involved in that process, right? So we have talked about a lot of different things, you all, and we want to give you all the opportunity to ask questions, to come off mic for about 10 minutes. Dr. Woodley, Travana, Ramona, and Lester are with us until 10 o'clock. And so we have about 10 minutes for question and answer. So please feel free to hop off mic, put a question in the chat, although I would love to hear, and I know that Jermaine would love to hear your voices as opposed to ours in this time. If you have any questions for Dr. Woodley, Travana, Ramona, or Lester.
Yeah, my name is Mark Cannon. I'm sorry, did I get ahead of somebody? Okay. I have a few questions. I am with the Family Courts, the education and career development counselor, and we get a lot of the students that come from the Kansas City area and outlying areas like Independence and Fort Osage, and we have a different type of population, and they've been put out of school for a lot of different reasons, and a lot of them have been, ones that where it makes it kind of hard to work with them because they were put out for things like bringing a weapon to school and stuff. And I put that in the chat. I just would like any type of feedback that anybody would have on, ways that I can work with them. I mean, all of them I have, it's just a few that don't have a deficiency. Most of them have a deficiency, usually in reading. We've been doing a lot of things in math, and that's helped some, but I think on the whole, it's kind of an uphill battle when I look at, just the amount of young people coming in. And if you set all of them in a room, you would think you were in a Sunday school class because they look like the nicest kids in the world. But there we are.
Because they are the nicest kids in the world.
Well, I know. And that's my philosophy. That's my philosophy. They're not bad kids. They just made poor decisions.
Absolutely. Absolutely. It's good to see you, Mark. Dr. Woodley or Travana, who would like to jump in with that?
Well, I could just first say, Mr. Turner, I hope you will start to see a reduction of the number of students that are referred from Kansas City Public Schools specifically. Okay, so I know with our trauma-informed initiative, what we are doing with our discipline hearings is we are trying to implement interventions for these students in lieu of long-term suspensions. So when we have, considering there's no immediate safety concern for students or staff, like we have to keep safe spaces. If we want our students to feel safe in our spaces, they have to know that they're safe. We are, partnering with community organizations because being trauma informed means, who can assist. We know we can't do it all ourselves, despite how large our clinical team is. We're interventions, life skills that's helping them to understand how to resolve conflicts without using a firearm or without resorting to physical or verbal violence. We, when there are substances involved, we are providing education regarding substance prevention. We are aware that if just putting students out of school is not providing the support they need to facilitate behavioral change. So we've adopted that. We commit to doing that within our school system. And I would just say, if and when students come to you, I would suggest doing the same. Connecting them with someone that they can see as a mentor that has a positive relationship. They are responding to what they've learned. It's social learning. It's what they've seen in their communities, what they've seen other adults in their lives do, and how they resolve conflicts. And so they are just modeling what they have learned. And so we have to break that pattern. And the way to do that is flood them with positive relationships, flood them with interventions that are, kind of catered to facilitate positive behavioral change. All of this does not necessarily mean, and I want to make sure I put this plug in here, that there is a mental health issue there. I want to make sure that I clarify that and really, reiterate that these behaviors that we see are not automatically indicative of a mental health issue. Okay, it is what trauma looks like. Okay, it is what social learning looks like. Yeah. We, again, as we talk about disproportionate suspensions and discipline referrals for Black and Brown students, we have so many students that were referred to our community mental health centers. Or they have ADHD, or they have, oppositional defiant disorder, or they have, it's trauma. And, a prescription isn't going to change that. What we have to do is engage them in a different way where they feel safe and connected, and then they can start to respond differently. So I hope that kind of helps answer your question with just some different types of intervention and really focusing on partnering them with really positive people to start.
I appreciate that. That's some of the things that we're already doing.
Thank you. We also have all types of information, of all types of evidence and data that suggests that even when it's something like violence, of gun violence, that our youth have the answers for themselves. We have that in different parts of the country where youth ambassador kind of community advisory boards are figuring out the ways in which to move forward, centering relationships, centering impact on community to help move this forward. And so our kids have the answers if we help to provide them with the resources and supports to move forward. Dr. Woodley, were you going to share something else?
My only thing that I wanted to share, what we see, at least in Kansas City, is our surrounding areas, the high propensity for students to be expelled from school and be in those situations. And we make sure we center the information on how can we reduce that and not have students that are not in school, because we know when students are not in school, that's when they're have a high propensity for getting involved in law enforcement and having to hang out with Mr. Turner. So one of the main things we try to do is make sure that we understand that traditional education does not work for all students, right? And so we try to, make a, distinction that, hey, maybe the student is not able to attend school in a traditional format, but we have an evening school program. We have, we have a virtual program. So we have different programs where we're still able to be connected. We're still able to provide services for that student and have them engage without them being outside of the school arena or outside the connected to the educational community. And so I think that is one of the pieces that we've got to, get centered on about this expelling of students and having them where they're not in school, and then the propensity to create that the school to prison pipeline.
I threw in the chat feed 8 dimensions of wellness, and these come out of SAMHSA, which is the Substance Abuse Mental Health Services Administration. That's a mouthful. And I think when we talk about youth mental wellness, we have to include all those categories. How we offering youth opportunities to work, so jobs. What about their physical well-being? What about the social, the spiritual? So everybody on this call can probably play a role in one of those dimensions of wellness for young people. And if we can look at mental health not just as somebody being broken, but mental health is health, and look at the holistic approach of how we take care of our young people, then we'll have better outcomes. So those 8 dimensions of wellness are so very important, because all of a sudden what happens is when you begin to look at the young person's issues from this holistic perspective, if I can't eat, we know this, if I come to school hungry, then how can I focus on learning? So all those different things are so important in talking about the wellness of our young people. And I feel like, Cecilia, this means that this is a part 2. we're going to have y'all come back for a part 2 of this because, you know, this is not enough time to discuss the subject matter. But I do think that we have most definitely scratched the surface, and there's so much more to talk about.
Absolutely. And a part 2, so we can discuss the great work that is being done and the ways in which that's being implemented in schools. So we're right at our 10 o'clock marker. And so I want to make sure that we give time for a closing remark from our panelists. And so I'd love to start with Ramona and Lester, and then end with Travana and Dr. Woodley as we move into our community session this afternoon, or for the last 30 minutes. So Lester, briefly, what is something that a tidbit that you would like to share with us?
I would just like to say, first of all, even though I'm on a panel, but I felt like I learned so much as it relates to traumas. And so I just like to also just thank Dr. Woodley, because some of the things she said is really pertinent to what I'm seeing in my work. So and everyone who spoke had great advice, and so I just thank you all for allowing me to be a part of this great panel.
Thank you so much, Lester. I look forward to seeing you soon down there in that beautiful part of your state. Yes, Ramona, what would you like to share with us?
Thank you for this opportunity. Definitely echoing the same thing that Lester said. Such a privilege to be online with Dr. Woodley and Ms. Travana, as they always just are leading the way with this work in the Kansas City area and soon our nation. And I stand by that because they are really making change, and it will be echoed throughout our nation. I just want to say, continue to lift your voice, listen to young people and lift their voices, give them the opportunity and the space to share. They are the experts in what they need. So please, please, please continue to listen to young people and give them the opportunities to share their voice.
Absolutely. Ramona and I are really excited about being in April and May, being in Kansas City with our youth, doing lunch and learns so they can learn about trauma in their brains, trauma and toxic stress, and how they can advocate for themselves. And looking forward to us having some youth ambassadors from the Kansas City area for Alive and Well. Thank you, Ramona. And Travana, last but not least, Dr. Woodley had a 10 o'clock meeting. She did let us know that earlier. And so Travana, please lend us into our next session with some words of wisdom from your wonderful, wonderful mind.
Oh, wow. Words of wisdom. I hope. Let's hope. But again, I just like to say that Dr. Woodley and I and our team, we are committed to this work. I will tell you guys, it's hard work, but we're in it for the good fight and for the long haul. We understand how this work will directly impact the violence we see in our communities, the the self-sufficiency and self-actualization that our students are able to achieve. And it starts right here, one little nugget, responding in a different manner when they present an undesired behavior. Helping them feel like there is someone that they can speak with or feel safe with is going to be the key. And so we are constantly advocating, educating, and and building those relationships. When we look at those social determinants of health, we look at the social work grant challenges. We can look at the social emotional learning competencies, and one thing they all have in common is building strong, healthy relationships, right? And so one of the things that one of my mantras, and I'll leave you with this, is I genuinely and thoroughly believe that relationships are the drivers of change, right? Building those strong relationships, even with that student that jumps and hops and skips on your last nerve, that your patience is just this short with, just increasing that just a little each day, and you'll gradually see that change in that student. And that's the message that we're communicating with our educators, and that's what we're modeling when we're in the schools. So words of wisdom, relationships are the drivers of change.
They are. Relationships, relationships, relationships. The restorative practices, trauma-informed practices person that I am, my heart is full to hear you say that. Like, so many people think that it is a magic potion or a magic wand. We have to move across things, and really it's a relationship. When I was in buildings as a teacher or an administrator, it was amazing. The magic wand was seeing the difference that a student had in walking across a 6-foot hallway to another teacher than they did the teacher that they had the relationship with. Their behavior and the ways in which they engage was so much different. They behave so much differently than those that they did not have a fully fleshed relationship with. So it is the center and it is the navigator for change. Thank you for that, Travana. You all, if you're able to stay with us for this last 30 minutes, we appreciate you. Panelists, thank you so much for being here with you. We look forward to the work that we will continue to do in Kansas City, St. Louis, the Boot Heel, and all across the state. And thank you for the great work that you are doing.
We are so excited that the Cultural Competency Collective of Greater Kansas City is a program now alive and well. And we could not do this great work without having people who believe in the work. And so we're grateful for the funders who have helped make this possible. The Jackson County Mental Health Fund, Health Forward Foundation, Reach Healthcare Foundation, and the Schumacher Family Foundation. Without that funding, we couldn't do this work that we're doing today. So we are just so excited for those supporters and funders of Alive and Well. And we're excited about offering more of these learning experiences for the rest of the year. And we need your input. We don't want to do this in a silo. We want to hear from you what topics matter. And so I'm going to put in this chat feed a survey that you may have received. If you haven't completed it yet, please do so. But please let us know what topics you would like for us to take on this year by way of the survey. But we're going to also give you an opportunity through breakout rooms to have that discussion also. But if you have to leave, please use that link, if you would please, in order to let us know what you want to hear. We are so excited that one of our moderators, I was one, Cecilia Leather, will be our speaker in April. And so, Cecilia, will you please share just very briefly kind of what we're going to talk about at our April learning experience? That's going to be April 20th. I put in the link in the chat feed a link for you to register in advance for that. So, Cecilia, what's going to happen in April?
I'm not going to be talking at you. It's going to be very interactive, and we're going to be looking at race, equity, diversity, and inclusion, plus accessibility and belonging as a restorative practice, as a trauma-informed practice. So what does that look like for us? If we're really utilizing the Missouri model for trauma-informed schools, the Missouri model for trauma-informed care, and we're centering equity, then what does it mean for us to move forward in a way that focuses on our cultural humility, focuses on a way in which we culturally respond to one another, build relationship with one another, ally with one another, centering this very important work. And so it is looking at these things through that equity lens, through that trauma-informed lens, so that we can do the things that we need to do to better our communities, that our students, that our families, that our communities dwell in. So that's what we're going to be doing together. It's not going to be a whole bunch of Cecilia voice. It's going to be a whole bunch of you voice. And so that's what we'll be doing in April.
Well, we're excited to hear that. We're going to give you about 10 minutes in a breakout room just to discuss amongst yourselves some topics you would like to have lifted over the course of the year. If you would please choose somebody to be your recorder, and that person who's your recorder will also be your reporter to report out to us kind of what you want to hear. I know that some of y'all are dropping off like really quickly, so I want to make sure we do get those who want to remain in breakout rooms for about 10 minutes. So we're going to go ahead and launch those rooms here, and we'll give you about 10 minutes in the breakout rooms.
And remember, relationships as we're jumping off this call, right? Relationships is how we do this through breakout and Zoom in the time of a pandemic and Zoom. So yeah.
All right. So we'll see you in a moment. Let's see here. There we go.
Also, I was remiss, you all. I forgot to mention Jennifer Brinkman, who is the executive director of Alive and Well. Jen is not feeling well this morning, and so is quiet, but I will do so when we come back in as well.
Ramona, Travana, I didn't put y'all in breakout rooms. But yeah, didn't know if you would like to, just flag me and I'll put you in somewhere.
I was just prepared either way, Micah. So, you know, I'm resilient like that. I'm adaptable. So if I would have been in one, I'd roll with it. If I'm not, I'll roll with that too.
Absolutely.